When people hear that there is a hemophilia program at Orthopedic Hospital, they wonder about the connection.
A person with hemophilia doesn't have enough of one of the proteins in the blood that's necessary to make a clot.
The number one problem that young children have who have hemophilia is bleeding into their joints. When they bleed into the joints, the blood causes a reaction. It causes a severe inflammatory reaction that sets up a severe progressive arthritis. And that arthritis can destroy their joints before they even reach adolescence. So they have a crippling disorder because of the arthritis associated with hemophilia. That's why the program is at Orthopedic Hospital. That's where I get involved. I've been the orthopedist involved with this program most of my career. And I treat children and adults with hemophilic arthropathy, the arthritis associated with hemophilia. What happens is the blood in the joint causes a reaction, and the lining of the joint becomes very thickened and very inflamed. It's called the synovial membrane.
When the synovium is irritated, it gets full of extra blood vessels, it gets large, and it exudes even more fluid, so that a joint may be swollen with synovial fluid and may catch as a person moves a joint and bleed some more because of all the blood vessels in the synovium. So there's a vicious cycle.
That cycle has to be interrupted. And the way we do it is by getting rid of that inflammatory synovial membrane. In the beginning, we did it with a big operation. It was painful, it was expensive, and it resulted in stiffness of the joint because the joint hurt so bad afterwards the children couldn't move it, and it became permanently stiff. Today, we do a RadioSynovectomy. It's a simple outpatient injection procedure that was introduced in the United States by Orthopedic Hospital. It is highly effective. It reduces the thickening and the inflammation of the synovial membrane and greatly reduces the frequency of bleeding. And it can be done in about 15 minutes with essentially no discomfort and at a small fraction of the cost. But the best part is it doesn't hurt, it doesn't result in stiff joints, and the patients do very, very well. We are so fortunate to have some of the finest, most dedicated hematologists, physical therapists, pharmacists, nurses, social workers to help us provide a team approach for these complicated patients. The advancement of care for children with hemophilia is the result of hemophilia treatment centers, and Orthopedic Hospital was one of the first and one of the leaders in the field in the United States.